When a complex crisis strikes, leadership is tested. Decisions must be made in seconds, and the right call can mean the difference between disaster and resilience. So are you really ready for the moment when everything is on the line? Welcome to Season 4 of the Crisis Lab podcast, a show where we break down the toughest challenges in crisis management, emergency response, and risk leadership. And with every episode, we go beyond the headlines, dissecting real-world, complex crises with those who were on the front lines. That includes leaders, decision makers, and experts who've navigated unprecedented challenges and lived to tell the story. This season, we're pushing the boundaries, from cybersecurity threats that can cripple entire nations to high-stakes disaster response and the unseen risks lurking in global supply chains. Season 4 is all about new frontiers of complex crisis leadership. We're bringing you the exclusive interviews with top emergency planners, intelligence insiders, and world-class strategists who will reveal what it really takes to prepare for, respond to, and recover from a complex crisis. But that's not all. This season, we're introducing something new. Short-form episodes packed with insights, perspectives, and commentary on the most pressing issues facing our communities today. These episodes will complement our deep dive interviews, giving you timely analysis and actionable takeaways in a fast-paced format. So if you lead, manage risk, or simply want to understand how the world stays standing when everything falls apart, then this season is for you. So hit subscribe, follow us on your favorite podcast platform, and join us as we pull back the curtain on the world of complex crisis leadership. Because in a crisis, knowledge isn't just power, it's survival. So Nathan, thanks for joining us. Welcome to the podcast.
Thanks. Happy to be here.
So before we get started, maybe just a quick background and introduction from your side about where you're from, what you're working on, and the different challenges that you face today.
So I'm from Atlanta, Georgia, or that's where I currently reside. I've been in the field of emergency management and public health now for a number of years, and I've been involved in everything from local government, state, federal. I've done some federal contracting, as well as worked in the aviation side of emergency management. Ultimately, my goal is to kind of look at ways we can intersect these fields, public health and emergency management, to address some of the larger issues that we have coming up in the future. And in this case, climate change, I think, is, I joke, but I'm also very serious when I say this. The reason why I went to emergency management is there is a great degree of job security, and climate change is part of that job security. It's a sad factor to say that, but it's also very true. I knew that I would never not have work because of climate change. And so with that in mind, it falls on emergency managers of public health to really emphasize this as a true emergency management issue and a public health issue to address.
Yeah, thanks for that. Largely, I would agree. I think we're already in these times of really complex crisis exacerbated by a changing climate. And regardless of the causes of the changing climate, things are getting more complex these days, right? Hurricanes hitting the United States, flooding and wildfires and extreme wildfires and all these sort of things going on that we obviously, there's something there that we have to deal with. And I think we can all acknowledge that and work with that. When we talk about this and the aspects of climate change, and when developing the course with Crisis Lab, you had mentioned something called social determinants. And I think it's important to sort of unpack that and talk about that a little bit as we get started with the podcast today. Let's just take a second to sort of define that from your perspective, and then what that means for the field of emergency management.
So social determinants of health, I can give you the dictionary definition or the academic definition first, and then kind of go from there. But they're essentially the non-medical factors that influence health outcomes. Okay, so that's things like your economic stability, education, access, and quality, neighborhood and built environment. So for those that haven't had that course, built environment is the areas, the cities built around you, the buildings around you, that type of structure. And that's also like social, it could be context, meaning things associated with your attachments within the social spheres. So do you have a support network? Are you plugged into the community? All those things are essentially playing into how well you are going to function with yourself from the health perspective. If you don't have those things, it makes it harder for you to navigate the healthcare system, to get access to healthcare. We often think about it as an individual's choice, but it's also so contingent upon the conditions that we're in. Social determinants of health constantly are playing on that. So you take like a homeless individual, for instance, and their social determinants of health they have so many, typically they have so many issues where they are vulnerable due to lacking more positive aspects, protective factors like economic stability. They oftentimes might lack in education access and quality. They're definitely going to be lacking in terms of being able to go to the doctor randomly. Just because they have a cold, they're probably going to end up in the ER. Obviously, we know that the neighborhood and built environment is going to be a significant issue for them. And then finally, in the social and community context, the only support they may have is from other people that are also operating in the same sphere. And they don't have a lot to be able to support either. So it's a very challenging situation for those individuals. And I think that issue actually bleeds into what we need to look at when we talk about climate change. This is just an example from the US side, but you want to start looking at individuals in climate vulnerable areas are experiencing comparable situations due to warfare or other humanitarian crises. It's a very similar circumstance. In some cases, is even worse because you have the warfare component, right? So we have to look at it with this in mind as this emergent issue that these people are so vulnerable and social determinants of health will make it worse. And then you throw in climate change, which just exacerbates all those factors. It's going to become a sort of domino effect where things will just progressively get harder for them. And as an emergency management professional or public health professional, it's getting harder for you too.
Yeah, that's very interesting because we've seen in the last few years in some of the work that we're doing an expansion upon that idea and looking at more societal resilience writ large, blending into the aspects. And even FEMA had released this resilience maturity framework and model. It was incorporating systems into this in terms of community resilience. And that's also very interesting because it's starting to recognize the impact of our environment. Now, for our military colleagues, we would frame this as if we were military forces going somewhere, this is our operational environment. Being in the middle of Afghanistan, middle of nowhere, shapes outcomes in terms of medical and health and access to medical facilities and everything else that goes along with that. And it's also interesting, it's just sparks in my mind when I'm listening to you talk about it. If you remember that heat wave that hit Europe a few years ago, and then 100 something or more people died in France simply just because the environment, the social environment is largely no air conditioning and things like that, just wasn't really incorporated into society. And yet that had a determinant outcome on a significant change in the heat wave, right? And inside of Europe. So climate sort of change leading to more extensive heat waves, more extreme wildfires, and then yet the environment that people live in a moderate environment was built and accustomed to be just for that. And when that climate changes, it's no longer feasible. Does that sound sort of right to what you're talking about?
Yeah, I mean, that's a good example of the built environment component and how it, depending on the level of social community context we have, like social attachments, that could have acted as a protective factor. In this case, with the built environment piece, it wasn't something that there had been a lot of experience with previously in Europe where individuals, air conditioning wasn't really something that people are that concerned over with Europe. That's just not something that they've had to deal with a lot. Infrastructure on the individual level wasn't there as much. The responses typically in the US does this frequently, and I can talk from my own experience, cooling centers or heating centers for different weather, especially where I'm at, which is Atlanta, Georgia. In Atlanta, Georgia, we have those throughout the year because we have pretty severe amounts of heat. So you combine that with the urban landscape that you have in areas where you don't have tree cover. You can have the heat island effect, which we'll talk a little bit more in class about. And so naturally, you need some cooling centers for especially like homeless individuals, like I mentioned, or low income individuals who may not be able to air conditioning. Atlanta, Georgia is not cheap when it comes to utilities in the summer. And likewise in the winter, because we have infrequent, really cold weather, people are not prepared for that as well. Emergency management here often has heating centers that they will open up during the winter for those individuals. And Europe, just because they typically did not have those levels of extremes, they were not prepared for this level of heat wave. As a result, you saw many, many deaths.
Let's stay on that topic for a second. These social determinants of health and the intersection of climate and climate resilience, specifically in your field of public health. And so we mentioned a couple of examples and some factors that we have to plan for if you're coming from the emergency management profession. But what role do these play in planning for future challenges? So if we know, like in your case with Atlanta, the hot and the cold season, the summer and the winter, there's certain aspects, but I'm sure it goes beyond that. just aside from the centers. And there's a lot more that has to be considered, especially the longer you look into the future. So what sort of role does that play in your planning and the things that you think about?
Yeah. So actually, my interest in how this will interplay really started with looking at the humanitarian challenges when it comes to complex humanitarian emergencies. So when we think about complex humanitarian emergencies, those are situations with individuals in a cascading set of emergencies, usually with a warfare component attached to it. So I wrote my thesis on the topic of looking at intersection of climate change and public health in the context of complex humanitarian emergencies. So naturally, this is my topic of interest for sure. But social determinants of health is at the core of the whole thing. The reality is while the US or more developed countries will experience climate change and are going to have problems with climate change, people that are really going to be affected are going to be the people in very vulnerable areas already experiencing disasters or are vulnerable from the social determinants of health scale. That's going to be in the US as well, but it's especially going to be in those countries that are still in the underdeveloped stage or just now getting the developing stage, or of course, coastal. So that said, when we look at how we address climate resilience and how we plan for this, we really need to look with a great degree of detail at those areas that are vulnerable from the country level and local levels, even before we get down to the individual. Once we assess that, you look at climate projection modeling to really get an idea of where that's going to be. We then need to say, okay, this community is going to get hit by climate change potentially very hard. Who are the most vulnerable members of those communities? You can use social determinants of health as a framework for that. That's why I mentioned the homeless individuals are one of the major groups that are going to be the most exposed when we think about climate change. You're also going to have climate refugees, which is individuals that are going to be displaced from their home, that are going to have to migrate to other areas as a result of climate change. In fact, Atlanta, Georgia is going to receive a ton of climate refugees by 2050. That's the projections from the coastal areas of the US. And so the US needs to be ready to adopt their cities for this influx of refugees. And particularly Atlanta has been doing some initiatives towards that. But I would argue that there's a lot of room to grow because it's a sizable amount of individuals. The numbers I heard, I expected the metro area to get over 10 million, and that was before you factor in the complete numbers of climate refugees. That's just normal projections. So it's going to be a real challenge. We have to think about the changing mobility of population groups. We need to think about the fact that things that we've taken for granted as being the norm. So whether that's economic stability, neighborhood and environment, and the social cohesions, they may not be there anymore. And so we have to factor in how those things are going to change and who doesn't have that now and who's likely not to have that in the future.
And that's a really good point on the migration piece, because there's a separation between, okay, there's immigration, there's migration, and of course you have internally displaced persons from a massive climate-related disaster forcing a displacement of a population. We evacuate Florida, just as an example. Long-term displacement leads into migration because there's no ability to move back home. And you're talking about millions of people displaced and having to migrate more centrally into the United States, away from the coastal areas because of exacerbation of climate situations in the environment. And so that's obviously going to require massive investment in terms of public funding, because the way you're talking about, it's everything, right? So long-term displacement requires social cohesion, requires an integration ability, which means the school systems, the jobs, the bureaucracy, and the administration of a city to be able to handle all that goes with that and the long tail of logistics. That's a significant investment as well. But if we focus on the health system component and public health component, what would you be looking at in terms of this forecast? If somebody's like, okay, we're looking at millions of more people coming in to our community in the next sort of 20 years or so, what is going through your mind and why is this becoming increasingly important?
I definitely have my sort of wish list that I don't think would happen, but I do think it's really important for public health and emergency management to work more in tandem to address some of these more systemic problems. We often think of emergency management as being a short-term solution oriented, group. And in some ways, we have some mitigation aspects to it, which is prevention aspects in the different phases. But we often don't associate it with addressing homelessness. But that is one thing that shouldn't be in the forethought. Sometimes emergency management is going to have to cross over in that realm and work in tandem to address these larger vulnerabilities that are there. And I think we're kind of headed there, as you mentioned, with the systems frameworks that FEMA has been putting out and some other organizations with this emphasis on community resilience. It tackles that, but we have to put that in as a central piece as addressing the current vulnerabilities that do exist within the area. So whether that's homelessness, whether that's income insecurity, whether that is there shelters even now for people where people are currently at? It's hard to plan for the future if you can't address your current emergencies, right? So I think the first step is really, okay, what can we do to make our areas more resilient? And how do we focus on making sure there's continuity in practice for the next 20, 30 years? That to me is probably the most important. We can handle one emergency that displaces the population, about like 5% of the population. Just double that, and just assume that you're going to need more. I understand that resources are stretched thin for everybody, but the reality is that planning needs to go into place there. And the goal should be to have that in mind. I think we have an opportunity, not necessarily a taxation, if you will. When we think about climate change, we always think about it as this cost, that in order to do anything about it, we're going to have to invest all this money and we don't get anything out of it. There's a lot of opportunity within addressing climate change to build new structures, innovate, and give people a chance to demonstrate their skills in ways that would allow for these people to have income or jobs or have new opportunities for growth. I think these things actually play into each other and build upon one another to create more resilient systems by providing this opportunity. In the past, every time, once again, speaking from the U.S. perspective, every time that there's been a challenge where we've said, hey, we need to address this emerging threat, the U.S. has managed to do that. There's been a call to action, and people have answered the challenge. And as a result, more jobs, more sustainable structures, or more structures in general, the infrastructure was created. And we just continue building on those things, until we actually look at this as a challenge to be addressed and mobilize the community against it. I think that's what we're going to have difficulties with. I think that's part of the planning. We got to actually say, this is the challenge that we need to face, and we're going to mobilize the community against it. And we're going to work together to make sure we're ready.
Hey, just a quick break to remind you that the toughest decisions don't come with a warning. The people who handle them best are the ones who prepare in advance. At Crisis Lab, we explore how professionals across the various different sectors think ahead, manage risk, and make sound decisions under pressure. Get ahead of the next challenge. Check out crisislab.io today. So when I hear you talk about these things, it makes me very curious. I'd just like to hear your opinion. Do we find that emergency management as a profession is getting more sort of left of emergency, sort of more left of bang, where we need to start discussing or being a voice in social policy and things like that, in terms of, because you mentioned like the homeless crisis and that being a pretty extensive vulnerable population to climate changes. Do we need to have more or be more vocal in these areas, as opposed to where we typically, within the emergency management community, I think a lot of people have ideas about cross-cutting resilience, but we are also siloed into our silos of excellence, I guess I would say, because we focus on response, or we focus on preparedness, or we're a training and exercise person, or we do mitigation grants and things like that, or we're in a prevention field. We're siloed. These things are not necessarily now emergencies, but by getting involved and having a voice in that process and developing policy and public policy, then you can sort of get more into that prevention/mitigation space at a policy level, as opposed to threats and risk and hazards and assessments. And what are your sort of thoughts on that?
Yeah. So at one point I was in AmeriCorps. I was working at a food bank, and I remember, I think it was my boss who had the slogan, who was like, his goal was to work himself out of a job. I want the same goal for every emergency management and public health individual. I want the goal to be to work yourself out of the job. And so, yeah, I think we need to be more comfortable with the notion that we want to fix things so that they're not there. I am firmly convinced that I will have job security, but my goal is to work myself out of the job. There's absolutely no doubt in my mind that there's going to still be emergencies and that whatever measures we take is not going to be sufficient to prevent them. But there's also a reason why FEMA has made an additional phase of emergency management, which is prevention, because they recognize the need for it too. This is the prevention piece right here. We need to be more vocal. Let's address homelessness. We should try to address any sort of systemic vulnerability that we can. It will make our job easier. From a practical no, it will make our jobs easier. If it makes our jobs easier, then why won't we do it if we have the ability to do it? And just be very clear about it. That's kind of my perspective on it. If it might be controversial to say with homeless people, then like I said, let's be very practical about it. If it can appeal to you on your value system, then let's just talk about from the business perspective, which is it's better business to help homeless people get in a position where they're less vulnerable. We could talk all day about what we should be doing in terms of what the specific intervention should be. And that's a totally valid debate. But to not address a systemic vulnerability seems like a bad decision, basically, if I'm being honest.
One of the challenges too, there's as many perspectives on emergency management as there are emergency managers. You have the private sector, public sector, you have critical infrastructure, you have business continuity, you have all sorts of just different perspectives and functional areas in this large field. It's cross-cutting across many domains. But in terms of public health, what you're facing and what you're looking at, we talked about making difficult choices about how to deal with future challenges. Have we seen any successful implementation of a climate resilient strategy in the public health domain? Has there been something, just as an example, so we can better understand or quantify what we're talking about?
Yeah, so we talked a little about this in the class. There are some countries that have had some level of success, and I think it's easy to get really overwhelmed with climate change. You see a lot of young people, especially, that when we talk about climate change, they go to the despair side of things, where there's like the previous generation didn't do enough, and so now the world is ending, and so we don't care. I've heard that exact opinion from other people in the fields, especially people entering from public health. It's a true level of despair that people can have when it comes to climate change. It's almost like paralysis. So there are examples of success, and I think it's easy to get overwhelmed, but keeping these models of success in mind, I think it's helpful. Some of the areas we talked about is like South Africa has done a fairly decent job of getting their program up, and they've been working on that program since 2002. The US has started working more aggressively, depending on the, different goals of the incoming administration that could change or that could, deviate from what's currently at. But there's, for instance, the CDC has a climate and health sector. It's a relatively small team, but they have some funding and something called the BRACE grant, which is used to award so much money for different climate resilience projects in different areas. And so those projects are helpful, and they can be used in more of a holistic way, which in some of the ways that I mentioned, because they kind of have a broader definition of how that work. Even some of the countries that were impacted by the heat wave in Europe did better than others. In fact, if you attend the class, you'll know who did the best or who came out in a less negative light. Let's put it that way, because there were certainly a lot of challenges. We talk about a comparison between the countries. And yeah, there's definitely some lessons learned that you can take from the class about that. But yeah, there's definitely some level of success. It is still early in how we will see what level of success we have. And some of it's hard to quantify at times. But now I think is actually the time for people to take action. We're past a lot of the mitigation stages of climate change. And so we're at that point where we need to do a lot of adaptation. In your area, it could become too late to start planning for that. So it's important that we take action, use some of the strategies that we talk about in this class.
Yeah, thanks for that. And that's one of the reasons why we wanted to sort of have you on, but then also develop a course, is because I think a lot of the things that we focused on in the past are sort of what we already know. We need to look at what's coming up next in order so that we can actually really be prepared, beyond just preparedness and exercises and things like that. So there's really tough policy decisions coming. And I think that especially in terms of complex crisis and prioritization of efforts and all sorts of things. And climate is just one of them that you said already is going to exacerbate everything else. So that's going to be a tough sort of policy future ahead for all of us. So sort of a final question we have is, what advice would you give people who are, say, working in public health or public health authorities and policymakers who are looking to actually strengthen their systems and their communities' resilience to climate change? You mentioned it's really in its nascent stages. It's already started, but it's slowly gaining momentum and building. And there's different government organizations being formed to sort of look at this. But what would you say, what are some things that people should start doing?
Yeah, no matter where you're at, it's important to start looking at developing as much community resilience as possible, and don't fall into the trap of thinking you can't be affected. I grew up in the Appalachian area in Northeast Tennessee, and I can tell you, you can absolutely get hit by a hurricane. I'm back home is still very much in the recovery process. So don't fall into the trap of thinking that you're out of the woods either. The main thing is just try your best to ensure that there is community resilience within your community. Make sure that you factor in unusual weather events for sure. Like that is something that I would put any emergency manager's back pocket. We talk a lot about, when we think about IRA in the emergency management sector, we don't include climate modeling. We don't include any sort of is this disaster, something that could happen in the future. We use a lot of historical data. And, it has this, how many times this happened in the past. And sometimes we just get hit the hardest by things that never hit our area. And as a result, that's way harder than something that's hit us before because we're not used to it. Expect the unexpected and be ready. Emergency management across the globe at this point. The all hazards approach is what we're supposed to be operating under. But I think a lot of emergency management, a lot of public health doesn't operate under an all hazards approach. They go, well, this is probably what's going to affect our area. Start operating under the all hazards approach. Assume anything can hit you. And I think that's going to be a very positive way to do that. The other piece, which is really address social determinants of health, look at those as a key indicator of things to really look at. Look at climate change as an opportunity. When you talk to public officials, when you talk to individuals, it's an opportunity to change your community and pull your community together. It's opportunity for jobs and the environment with the right funders, with the right private donors or whatever group you want to pull in. But we just don't want to leave it completely. One of it is we don't want to look at it as just a burden, because when we look at it as just a burden, it's really hard to appeal to people to help. Okay, you just want to mess with the system that we already have, not saying let's continue to build this system and make it better. So those are probably the three pieces I would really harp on. I know they're rather broad and they're not going to give you specific strategies, but you want to come to the class, we delve a little bit more into that. We'll talk a little bit more about some of the monitoring evaluation pieces. We'll talk about specific frameworks you can use, and that can just augment what I've already said. Hopefully, we'll see you in class.
All right, Nathan, thanks a lot. Thanks for your time today. Really appreciate you being here on the podcast. If somebody wants to get in touch with you, what's the best way to do that? Should they just reach out to you on LinkedIn?
Yep, LinkedIn will be great.
All right, we'll leave a link in the show notes. All right, everybody, thanks for your time today, and then we'll see you on the next one. Thanks.
Thank you.
And to our listeners, thank you again for tuning in the Crisis Lab podcast. We hope that today's episode has provided you with the insights and perspectives you need to better navigate the challenges of your field. Remember that each episode is a step towards mastering the complexities of crisis management, and we're here to share the knowledge and support you along the way. If you're not subscribed already, head over to your preferred platform, hit subscribe, and keep up to date with our latest episodes. For more resources and to become part of the 18,000 plus professionals following Crisis Lab, head over to crisislab.io and make sure you follow us on social media, such as LinkedIn and YouTube. Until next time, stay prepared, stay resilient, and let's continue to make a difference together. Thanks for listening.